Hey YouTube, Tone Tiger, Cece here. Yeah, I just got back from my pre-op visit with the doctor. I have 13 days till my surgery. And yeah, I had my pre-op visit with both the doctor and the anesthesiologist. The visit with the doctor went well. I went over all my questions, had all my questions answered as far as surgery. Surgery's still scheduled on the 15th at 12:30. Let me see, I gotta get my notes that I took here. I love my surgeon. He answers all my questions and sits and talks with me and just takes all the time that he feels like I need, without feeling, rushed or anything. Yeah, I asked about his technique. He still uses laparoscopic technique. He doesn't use spider. A lot of the surgeons, spider's still so new that they don't, they feel like they have to practice on it, I guess. I don't know. That was his take on it, was that he hasn't been able to research it well enough to practice on it well enough, or something like, I can't remember exactly what he said, but something about he hasn't been able to do the research on it well enough to be able to start implementing it in his practice. So he doesn't use it. So he still uses laparoscopic, and it's usually 5 incisions, and he pointed out the incisions on my stomach, but obviously I can't remember exactly where they are. He does still use a drain, and that will stay in for the duration that I'm in the hospital. And I found out, I thought I was only going to be in the hospital for a day, because I guess I got my paperwork from the insurance, and it said that I was approved for a day. So I thought I was only going to be in for a day. Well, come to find out that that's just the way my insurance does things. He's going to keep me for at least 2 days, possibly 3. So it looks like I'm going to be in the hospital for at least 2 days. Which means the drain will be in for at least 2 days, possibly 3. He will take it out, barring no complications, the day I leave. But, no catheter. Yay! That's right, no catheter. So, I guess I can handle a drain when I don't have to have a catheter. Size bougie. I was very surprised to know that he uses a very small size. He basically said he uses the tube, like the same size tube that they use for endoscopies, which is basically a 28 French. And when I asked about that, he said, sizes vary all over. You could ask 100 different surgeons what size they use, and you would get 100 different answers. And it comes down more to technique and whether or not, when they put the endoscopy or bougie down, do they pull the stomach really, really tight and cut really, really close to the bougie, or do they, not pull as tight and not cut as close? It's all about that type of technique and what they do. He didn't obviously tell me exactly how close he was going to cut things, but it does sound like it's going to be rather small. I told him my concerns about being too small and, related to my health, and he said, based their practice, they have not had any complications with that technique. Real complications with that technique in the years that they've been doing it, which is, this practice has been around for 15 years, so I feel pretty comfortable and confident with this practice. So, and definitely very confident and comfortable with my surgeon, because like I said, he just, he sits down with me and makes sure that, are you sure you don't have any other questions? Are you sure? I did ask about long-term health complications, I'm not talking about right after surgery. I'm not talking about leaks. I'm not talking about, surgery complications. I'm talking about 2 years down the road, 3 years down the road. I'm talking about even nutritional complications further out. And he said that so far they haven't really noticed that many complications. And he said a lot of times the complications that they notice have more to do with patients not following the rules after surgery, more so than ones that follow the rules of surgery. Meaning, you go off the diet, you start not really taking care of yourself and not coming in for follow-up, and all of a sudden you come in for follow-up a year or two, later when you haven't had follow-up for, a year or so, or 2 years. Those, you might start having nutritional issues or health problems related to, just the fact that you haven't been taking care of yourself, but not really necessarily, real health problems in the sense of related to the surgery. He's had one leak in the years that he's been doing the surgery, the actual sleeve surgery, which has been about 5 years. So not too bad. Follow-ups. I was glad to know that his follow-up was a little bit more, I guess, conservative in the sense of he'll see me obviously, the 2 weeks, 1 month, and then every 3 months. And then after that first year, it's every 6 months. I know some doctors are yearly, but he wants to see you every 6 months. So I thought that was kind of neat. So that's kind of neat to know that he'll see me every 6 months and do blood work every 6 months just to make sure we're on the right track and doing what we're supposed to be doing. So yeah. Surgery in itself, I'm supposed to report at the hospital at I think 10 o'clock on the 15th, and they gave me that lovely soap that I'm supposed to wash myself from head to toe, except for my face and, lady parts. Yeah, I meant to ask about hair, but I think I'm just going to braid it. I think I can't put, as you can see, I still have kind of bangs going on. I can't put bobby pins or anything. I don't know if I can wear like a cloth headband. I may have to invest in 1 or 2 of those. But I think I'm just going to French braid it back at the back of my head. I was going to try to do 2 French braids, but I don't know how. I only know how to French braid 1 braid. So I think I'm just going to French braid it in the back of my head here on the back. I don't have any, I don't wear, I have gold earrings that I used to wear, but I haven't put those in a while. So I'll probably leave those out. And of course, my pendant, I will wear it the day of surgery, but I'll take it off and give it to my husband when I actually go back, and he'll give it back to me when I get back. He'll give it to me in the room. So, because I wear this with me everywhere, yeah. So, I'll probably show you my bag, which won't be much. I mean, I'm not taking anything. I'm so basic, y'all. I'm telling you. I'm wearing the hospital gowns because I'm not buying crap to take to the hospital. I'm just not. I'm only there for a couple of days. I don't see the point. I'm going to wear one hospital gown one way and one hospital gown the other way to cover my backside. The only thing I bought was some slippers so I can walk around, do my laps in the hospital. Although I did hear, you know how they've updated the birthing rooms? If you've had a baby anytime in the last I don't know, 5 years, how they've updated the birthing rooms, and they're really big and they look like hotel rooms. That's what apparently my room is going to look like. I can't wait to see it. I will definitely try to do a video and show you guys while I'm in the hospital. Hopefully I'll be feeling pretty good. I did ask about swimming because my son Gabriel, his birthday is literally a week after my surgery, and we usually do a swimming party for him. I won't actually be going swimming. I'll probably just be sitting in the little kiddie area, and I know I'll get wet from being splashed and stuff, and I'll probably be sitting, you know, kind of in the pool. So I asked if that was okay, and no swimming for like 4 weeks, like actual swimming, or bathing for that matter. Not bathing, I can take a shower, but no like taking a bath or immersion type things in like a hot tub or a bath. But I can do that. That's okay, so that's good to know. It kind of stinks on the swimming part, but at the same time, I'm okay with that because I'm not a fish or anything, so no big deal. Although, no hot tub kind of stinks because I like hot tubs. But anyway, so, yeah, I'm excited. 13 days, y'all. It's getting there. I will do my update on Thursday, although I'm thinking about moving them to Mondays because, you know, like I said, my surgery's on a Monday, but I don't know. I usually have a hard time doing videos. You know, Thursdays are usually, they just work better for me. The only reason I'm able to do one today is because I had my doctor's appointments, and so I called my husband and was like, I'm going to do a video real quick since I'm already out and about and the kids don't, you know, they're already like not missing me, you know, they already think I'm out and about, so I'm going to do a video real quick. So anyway, so that's that. I will talk at y'all later. I'm all paid and ready to go, and yeah, so I'll talk at y'all later. All right, bye.